This right here is a picture of a normal knee. Now, you don't have to be a radiologist to read this. You have two bones and a space in between. We want your space to always look equal and even. This is where your meniscus is, your cartilage is. So as long as it's equal and even, you're probably doing pretty good. But what happens as we get older? Mr. Arthritis kicks in, and then we start getting it looking like this. You see how the joints in between the bones now are closer together? Some doctors like to call this bone on bone. I will tell you, most of the time people tell me that, they're not bone on bone. There's still some of that little black space in there. And that's all we need. We just need a little space that shows us that there's still some meniscus in there and some cartilage for the stem cells to attach to help stimulate growth. Dr. Dabbs here, it's awesome. They have an x-ray machine. So if you didn't have x-rays, they're gonna take them here. And when you see them, now that you're all radiologists and you know how to read this, you're gonna be able to look at it and go, well, let's face it, we're probably not this. But we really don't want to be this. This is getting severe. We want to make sure that this little space here is a little space all the way through. We're very honest with you. If we cannot help you, we're going to tell you. But we're also going to try to find a way to help you somehow. There are many people that I see that get to this phase. We try to get you before that phase. If you're at this phase, I will tell you that you might be a candidate for surgery at that point. Most people don't want the surgery. I know I don't. So I would say 99% of the people in this severe stage still get stem cells because they don't want the surgery. Now, can a severe knee like that go back to normal, to where you have a normal life? You know, it's very hard to answer that. But what it can do is stop the progression of where it's at and give you some relief. So if you're what we call a phase 3 or severe arthritis, it's worth trying. It's worth trying because it's only going to get worse. And if we can prolong or eliminate surgery for the rest of your life, that's exactly what we want to do.